Hi, my name is Rhonda Vassar, and I'm doing my project on depression, my Share My Knowledge project. I've got several images of people with depression. Signs and symptoms of depression. Depression varies from person to person, but there are some common signs and symptoms. It's important to remember that these symptoms can be part of life's normal lows, but the more symptoms you have, the stronger they are, and the longer they've lasted, the more likely it is that you're dealing with depression. When these symptoms are overwhelming and disabling, that's when it's time to get help. There are common signs of depression. Some common signs and symptoms of depression are feelings of helplessness and hopelessness, a bleak outlook that nothing will ever get better and there's nothing you can do to improve your situation, loss of interest in daily activities, no interest in former hobbies, pastimes, social activities, or sex. You've lost your ability to feel joy and pleasure. Appetite or weight changes, significant weight loss or weight gain, a change of more than 5% of body weight in a month. Sleep changes, either insomnia, especially waking in the early hours of the morning, or oversleeping, also known as hypersomnia. Anger or irritability, feeling agitated, restless, or even violent. Your tolerance level is low, your temper is short, and everything and everyone gets on your nerves. Loss of energy, feeling fatigued, sluggish, and physically drained. Your whole body may feel heavy and even small. Tasks are exhausting or take longer to complete. Self-loathing, strong feelings of worthlessness or guilt. You harshly criticize yourself for perceived faults and mistakes. Reckless behavior. You engage in escapist behaviors such as substance abuse, compulsive gambling, reckless driving, or dangerous sports. Concentration problems. Trouble focusing, making decisions, or remembering things. Unexplained aches and pains. An increase in physical complaints such as headaches, backaches, aching muscles, and stomach aches. What exactly is depression? Major depression is an episode of sadness or apathy that lasts at least 2 consecutive weeks and is severe enough to interrupt daily activities. Depression is not a sign of weakness or a negative personality. It is a major public health problem and a treatable medical condition. What causes depression? Doctors aren't sure what causes depression, but a prominent theory is altered brain structure and chemical function. Chemicals called neurotransmitters become unbalanced. What pushes these chemicals off course? One possibility is the stress of a traumatic event, such as losing a loved one or a job. Other triggers could include medications, alcohol, or substance abuse, hormonal changes, or even the weather. Who's at risk? Anyone can become depressed, but many experts believe genetics play a role. Having a parent or a sibling with depression triples your risk of developing this disorder. Women are twice as likely as men to become depressed. Depression and suicide. Depression is a major risk factor for suicide. The deep despair and hopelessness that goes along with depression can make suicide feel like the only way to escape the pain. Thoughts of death or suicide are a serious symptom of depression, so take any suicidal talk or behavior seriously. It's not just a warning sign that the person is thinking about suicide, it's a cry for help. Warning signs of suicide include talking about killing or harming oneself, expressing strong feelings of hopelessness or being trapped, an unusual preoccupation with death or dying, acting recklessly as if they have a death wish, calling or visiting people to say goodbye, getting affairs in order, like giving away prized possessions, tying up loose ends, saying things like everyone would be better off without me or I want out. A sudden switch from being extremely depressed to acting calm and happy. If you think a friend or a family member is considering suicide, express your concern and seek professional help immediately. Talking openly and about suicidal thoughts and feelings can save a life. Call 1-800-273-TALK now for help with suicidal thoughts. Some treatments for depression. Antidepressants change the levels of feel-good brain chemicals such as serotonin. While Prozac may be the most well-known, it's only one of dozens of options. If the first medication tried doesn't help, there's a good chance one of the others will. Side effects tend to be mild, but may include upset stomach, headache, weight gain, insomnia, and sexual problems. The combination of talk therapy and medication appears to be effective. Electroconvulsive therapy, also known as ECT. This treatment uses electric charges to create a controlled seizure. Patients are not conscious for this procedure. The seizure rapidly changes the chemical balance in the brain. ECT helps 80 to 90% of patients who receive it, giving new hope to those who don't improve with medication. Vagus nerve stimulation, also known as VNS. Vagus nerve stimulation can help patients with treatment-resistant depression that does not improve with medication. VNS is like a pacemaker for the brain. The surgically implanted device sends electrical pulses to the brain through the vagus nerve in the neck. These pulses are believed to ease depression by changing the balance of the brain chemicals. There is a good outlook for people with depression if they seek help. If depression is not treated, it can lead to suicide. Depression comes in all forms. It affects men, women, children, although, as I had stated before, it affects more women than it does men. But if you know someone that is suffering from depression or has any of the signs or symptoms that I mentioned, please get them help. Thank you.